From the living room to the Senate floor, from first responders to technology innovators. Different roles, different stories, but one goal: to meet the need for crisis care and overcome the obstacles together. So join in. The Crisis Jam is starting now.
All right. Welcome, everyone, to episode 234, of the Crisis Jam. This is the last episode of season 5. My name is Laura Evans, and I will be your host for this next hour. We will have a lead story from Global Leadership Exchange, Crisis Around the World. We'll be hearing from Sean Russell. So I'm super excited for this next hour. We've got some really great speakers. But let's get started. So those who joined us early in our backstage pass, they got some sneak preview to additional content. And we also had a sound check. So make sure that you drop in the chat where you are joining us from today. That is going to be our theme here with Global Leadership Exchange and suicide prevention leaders from all over the world. So let us know where you are dialing in from. You can also go to talk.crisisnow.com. And that's going to be your one-stop shop for everything related to the Crisis Jam. Now, if you stay till the end of the show, you're going to hear some exclusive changes that are happening with the website. I can't tell you just yet, but I promise you will want to stay all the way till the end to hear it, because it is going to be pretty phenomenal and impactful for where we get our information. So for now, you can still go to talk.crisisnow.com. You can see everything related to the jam, the different segments. You can also go to YouTube and check out all of the videos, all 234 once this one is posted. Make sure you like and subscribe, and you can also live stream it, I believe. You can listen in live if you can't access the Zoom. So the Crisis Jam across 5 seasons. Next week, we'll start season 6. We have had all of these topic groups here. You can see most often we've talked about system design. That's been so important. Peer support. We've introduced new segments each along the way, going live, hot topic debates, being live on location. We're going to be leaning in a little bit more into substance use these days as we are kind of getting further away from go live and implementation and more into various components of the system. But we need your ideas. We need your topics. Put them in the chat. Let us know. So we're going to start off with some crisis news, guys. Today is World Suicide Prevention Day, and that theme is Change the Narrative. So this is going to be really exciting day for leaders, again, all over the world, addressing and talking about suicide prevention. So making sure that we can change the narrative for folks who may be feeling hopeless. And then along with that, we have a number of international suicide prevention organizations, you see them here on screen, who have come together to issue a joint statement on youth suicide prevention. So again, so important in the US. It is the 3rd leading cause of death for young people, and it looks like that is the same for worldwide. So again, and thank you, Alan Woodward, for sharing the statement. So if you, there are links in the chat, but again, if you see some news, if you hear anything, make sure you send it our way so we can feature it. In addition to World Suicide Prevention Day, Monday, 9/8 was 9/88 Day here in the US. And so we'll be talking a little bit more about that with Nami and Steph Pasternak in this jam, but wanted you all to see just some of the tweets, Instagram posts that have been shared. Really got a lot of traction. Again, this is the second 9/8 Day. So shout out to SAMHSA, Vibrant, and others who have reposted and shared. And this is a word cloud that came to us from folks, I believe, on the jam, and kind of what they thought, what 9/88 meant to them. And you'll see here, hope is in the center. A lot of folks have talked about that. So again, let's change that narrative and let folks know that there is hope. This isn't quite the hot seat, but if anyone saw recently, and feel free to put that in the chat, there's a NFL quarterback who put 9/88 on their nails. So you'll see there the very cool design in addition to the suicide prevention colors. Does anyone know who this quarterback is? Let's see, I see some hearts. Okay, we've got a guess of the Commanders. Caleb Williams. All right, Caleb Williams. Yes, the quarterback for the Chicago Bears put 988 on his fingertips. So very cool. And thank you for highlighting that. Other news pieces for us. We're not going to get too deep on this one. This will be featured next week with Ursula Whiteside. But if you use AI for therapy, here are 5 things that experts recommend from the Washington Post. This is blowing up. There has been some recent news around individuals who have consulted AI for when they were feeling in distress and did not have good outcomes. So, taking a look at if you are going to use AI for therapy, what do we recommend? And if folks want to go back to the YouTube channel, there's a very great debate on AI that was hosted maybe a few months ago now. So very important. Okay, now we are at our hot seat. So we are bringing back for this hot seat, if anyone wants to sign up in season 6, we are bringing back the swag. So make sure that you reach out to folks, put your name in the chat if you want to be on the hot seat. And if you want to skip the hot seat and just buy the swag, that link is also in the chat. You can head over to crisisjam.shop for that. So for now, unless someone's feeling brave, it will be an open question for everyone. And that will be the first ever call to a national 3-digit emergency system occurred in what year and in what country? So you should have a poll up. Make sure you take that. Let us know what you think. Put some thoughts in the chat if you'd like to help out your fellow participants. This in the green room before this, we got this question as well. And none of us chose A, but we were sort of spread out. So it'll be interesting to see who else. All right. So it looks like we do have about 16% of the audience that thinks A for the US in 1968. Australia in 1958 seems to be first with 33%. Denmark 1947, 21. United Kingdom 1937 with 30%. Quite the split. We stumped you all. It was D in the UK in 1937. And they actually had these signs to help folks understand how to place the call, including how to use a rotary phone. But you could dial 999 to reach fire, police, and ambulance. So they were quite ahead of the US with our 911 in 1968. So we're going to hear from Sean with Global Leadership Exchange. He's based in the UK, so he can help shine some light on us. But the US was not first. And again, you'll see here in 1937 or 1935, 5 people tragically died because there was no emergency system. So you can now, again, still use 999 and of course 111 in England if you're ill or hurt or need help fast. So thank you for that. And then of course we have the 988 for the US that launched in 2022, July 16th, 911 in 1968. And then prior to the 988, there was an SPL. That same 988 number is also used in Canada, and you'll see here some of the resources for Canadian participants, and it launched 1 year after the 988 number in the United States. Australia has been around for a long time as well, 1961 for 000, 1963 for their Lifeline service. So again, this is all a global community. We're all in this together. Okay, so we have another question again for folks. This time we're going to do over or under. And so if anyone's feeling brave, please feel free to raise your hand. We can take you off mute because this one we will want to get your guess and then have the audience tell us if the correct answer is over or under what your guess is. And if we don't have anyone, I might call on, let's see, Debbie Plotnick. Are you here? Can you come off mute?
I am Laura.
Hi, Debbie. Good to see you. So, the theme of this jam is global leadership exchange. There have been over 500 active participants from 29 countries for this crisis jam. So, you'll see here split out by general, region, and country flags. The over under question today is though we've had 29 countries represented from over 500 participants. How many folks? Have been how many countries are represented in the 600 unique speakers that we've had?
So Laura, just a quick, and we've made this a little too complicated, but the what's on the screen now are our global events with Crisis Now and Zero Suicide.
Thank you for that correction, David. I'm
Yeah,
sorry.
and these countries have been a part of those global leadership exchange partners. Crisis Now 3 last year was the seventh event we've done over the last decade, and we've had this really broad participation in those events vis-a-vis the relationship with global leadership exchange. So that leads us into, is it the same with the Crisis Jam?
Gotcha.
Oh,
So does that help, Debbie? Do you
yes.
understand now? Yep. So
Thank you. Okay. So, 29 countries for zero suicide. How many? I would say it is under on the crisis jam.
So under 29 countries?
Yes.
Okay. All right. And let's see. If you think that there have been more than 29 countries represented across the 600 unique speakers in the 5 seasons of Crisis Jam, let us know in the chat. So you can say there have been more. So you can say over. If you think there have been less countries, less than 29 countries represented in those 600 unique speakers, you can say under. And David, you just help me out if I got that wrong. But we have Sue Murray who says over. We've got Megan with under. This is pretty split. Again, I think just like the hot seat. Okay, we've got a good split here. The correct answer is that there have been 7, so under
We
of
got to
those.
get more international folks.
That's right. That's right, Debbie. So if you know anyone who is doing something unique, has a really great perspective to share with us, please send them our way. Because out of 600 unique speakers, only 7 countries are represented, and you'll see those speakers featured here. So great work, everyone.
Thanks, Laura.
Thanks, Debbie. Appreciate you. So we're now getting into our lead story, again, with the Global Leadership Exchange Crisis Around the World. It is my pleasure to turn things over to Sean Russell.
Well, good afternoon, good morning, good evening to everybody who's joining us. And I'm really, really pleased to be part of this webinar this afternoon. So I'm Sean Russell. I'm the Chief Operating Officer and European Lead for GLE. And it gives me great pleasure to be here this afternoon. I just wanted to start off with a really big shout out actually to all of the crisis work that's been done through the Crisis Jam. And I've been absolutely so impressed with the work of David and the team behind the scenes to really shine a light on this really important topic. And the work that we do with Global Leadership Exchange as a partner with 988, the Crisis Jam, with Nashbid and a few other of our colleagues actually, is so important to share that really good practice across the world. And I was really thoughtful then to hear that actually you've only had a small number of international speakers at your Crisis Jam, and as part of Global Leadership Exchange, we will do our most now to try and raise that profile for you and help you with that work. But I think actually it's a really good testament to yourself around the work that you're doing. I've always looked up actually to David and the team for the work they've done, and actually the work that I did as an operational commander in the police previously in my previous world gave me some really good thoughts about what is right care from the right person at the right time. And sometimes we throw that leadership lens to look really quite far afield to think about what is good and what isn't. And I always looked at the work that was done by RI and the national team through crisis as a really good example of what good looks like. So next piece, if that's okay, David. I normally start off with a bit of a picture when I do presentations, and this might be difficult for you to see. But actually, one of the things that I've really recognised through the work that we've done with crisis is actually the drivers of international crisis are not a new phenomenon. We think about this going back to the picture on the left was a picture that was done by a very famous artist in England called William Hogarth. And he delivered a picture just as gin was brought into the UK. And it just showed the impact that gin had, as in the substance, on our population. So we saw an increase in suicide, we saw the issue around poverty, we saw people living on the streets, we saw the impact that that had. With the Royal Society of Public Health, they did a version back in 2016, so 250 years later or so, really just to think about, have the drivers changed? And in reality, the drivers of crisis are still the same. It's still poverty, it's still addiction, it's still the challenges of homelessness and the things that work out. So actually, for me, this is really interesting to put a bit of a leveler to say, despite all of the things that we've done over time, we are still having to think about all of those drivers of crisis. So it isn't something new for us, but actually how we respond definitely is. Next one, please. So I started my world in the justice system as a police officer and spent quite a lot of time thinking about how we respond to people in crisis. And in the UK, we've developed a really thoughtful process around making sure that we have the right care by the right person. And they called it the right RCRP approach. So what we're trying to do is think about how we reduce the involvement of the criminal justice system actually, and start to think about early intervention and prevention and making sure that crisis responses are dealt with as a health response, behavioural health actually, where we possibly can, rather than a justice response. So our previous approach has always been that police officers attended the crisis and much too often, even if there was no crime or respond to safety. And actually our officers had very limited training, particularly in around mental health, addiction, behavioural health or substance use. So what we're now moving towards now is a position where actually the police only intervene when there's an immediate threat to life, serious harm or a crime. That means that actually we're getting the professionals now to take the lead around health and behavioural health in a lot more focused way, which I think is really important. However, we do ensure that actually everything we do is built around a thrive, which is threat, harm, risk, investigation, vulnerability and engagement, a nice model that we use to manage risk within the UK. But actually what we're trying to ensure actually is also that new approach reduces the distress for the individual in crisis. And certainly the work that I've done looking globally is actually when officers turn up, the uniform actually is probably not the best thing for people who are in crisis. So it helps us start to think about the different approaches. Next slide, please. So as we heard in the introduction section, actually, we started the delivery of the 999 system, that 3-digit number. Then we've moved now to a 111. But actually, we are really focusing now on actually early intervention and reduction at a really early stage. So actually, we're really pushing our communities to go and seek help at an earlier stage, whether that's through self-care, where we've done lots of work on digital approaches. We've opened up our pharmacies to be more focused on actually how they support people at an early intervention. We have our 111, which is a non-emergency line, so not in time of crisis. So it gets us to get some support and advice. You can still go back to your general practitioner if you can get access. And I'm sure Phil Moore, who's a participant on the panel in a short while, will be able to talk a little bit more about that. We have urgent treatment centres, actually, which cope specifically around physical health, but it also picks up a little around mental health and crisis, or the A&E department around that 999 call. But actually, it still means that we're starting to work differently in that bit. But we are starting to think now about investment in crisis teams. We've moved away slightly from those joint patrols around policing, mental health and nurses working together in cars and ambulances to trying to think about how we do that in a more focused piece, a bit like the work that's been done in the US now, starting to think about whether peer support workers and that engagement is really engaged with health professionals. So reducing the amount of justice intervention, I think, is really helpful. But we're also focusing on data and monitoring and really strong public awareness campaigns. Next slide, please. So moving across to the European Union, it's a really big space actually, with 53 countries. Really fascinating to think about the depth and breadth of work that's going on across mental health and crisis. And they've developed a really strong European Commission mental health framework, which has got a number of flagship initiatives with a £1.2 billion investment. That's really, really important for us to think about actually how we really think about workforce development, cross-border collaboration between countries, started to think of how we use digital tools, and actually how we really focus on research. And in my day job, I'm also an academic where we try to make sure that actually everything we do is based in research so it doesn't cause harm. But there's a real focus on youth, particularly around youth mental health, to how we move people away from crisis intervention into a really thoughtful process around prevention and promotion, and build that sense around resilience and school and education system as the really key allies. We've done a lot of work around workplaces because we now recognise that people in the workplace are likely to be there for 45 to 50 years as the retirement age grows. So how can we be more health promotional in the way that we operate in our systems? And therefore also thinking about evidence-based policy, making sure that actually all of our indicators, our monitoring frameworks are all based around actually how we share that piece. So actually you are comparing apples with apples rather than apples with oranges, pears and pineapples, which creates that sense of real challenge for us. But there is a real drive across all of Europe at the moment to be more community-based. And I've seen that firsthand from my visits to working in local communities, thinking about how you engage communities right at the heart of that delivery around taking us away from social isolation, reducing the drivers of crisis to be really thoughtful about human integrated person-centred services. So really thoughtfully doing that bit. So moving on now, please. We've also really focused on a health in all policies approach to reduce crisis, and WHO Europe have just produced a really strong statement in the Paris Statement, which thinks about how we integrate public health and health across all of our policies. So that is ensuring that we engage all of our services and departments, whether that's education, justice, housing, social care, adult children's, whatever we do, actually making sure that we think about health in all of the approaches that we're delivering across the whole governmental and federal arrangements. And I think, as Dr. Hans-Henry Kluge talks about, as the director for the region for Europe, talks about mental health shapes every heartbeat of our daily lives, in the classroom, in the workplace, at the kitchen table, and in the corridors of power. And we've really got to think about how we start to really use that to drive out crisis and think about all of those early intervention and promotional opportunities for delivery going forward. Next one, please. We've got colleagues actually on the call today from Australia, but when I was looking at GLE, we've really focused as part of Global Leadership Exchange of thinking about the countries that we work with. We do lots of work with Australia, New Zealand and America and Canada, as well as Europe. And actually, here's just a couple of examples from Australia that actually, where the response to crisis is a co-response model alongside law enforcement. Queensland Police Service actually have a really strong strategy going to 2027, which emphasises that role around diversion and least restrictive intervention. And that for me is absolutely critical. It moves what I describe as policing services moving away from being a police force to a service where we're really thoughtful about those least restrictive interventions, and actually working with the health sector to really be thoughtful about interventions that are co-produced, co-aligned. And I think it's a really, really good example of actually how that operates and how that works. New South Wales also had a mental health strategy that created an action plan. We talked about ACT training, it talked about mental health intervention coordinators. It talked about mental health crisis teams and started to think about actually how all of that works collaboratively. So we've recognised that actually for us to deliver really good community services, it has to be dealt with in partnership. Collaboration has to be at the heart of it. And what I'm really excited about is the growing use of peer support workers that we're now starting to see emerge across Europe, across Australia and New Zealand, but also in the US. Because actually, having that individual who's been in that position to actually talk about hope, that delivery going forward, I think is really, really helpful. And what you'll see on the right-hand side actually is a number of hotline services. So unlike the US and the UK, where we have a three-digit numbers, actually there is still access points to Australia through 24/7 services. And you can see there the link then actually towards mental health, suicide prevention, and the planning around that for me is really thoughtful to join up all of those bits. And what I've been really heartened by, I think, is actually the way that we're now starting to think about crisis intervention, suicide prevention, and the delivery of healthcare and justice responses in a really collaborative approach, more thoughtfully now than probably we were 5 or 10 years ago. The next one, please. So I've raised the issue around New Zealand actually. New Zealand have just actually in the last couple of weeks delivered a really thoughtful crisis response to mental health and substance use, what works literature scan. It's a really good document. If you get the chance, I've left the link here in the slide. But what it demonstrates actually is some really good international learning, but also starts to think about what New Zealand are going to do, taking on the learning from the international scoping. And I think this is really useful to see how a country has looked at the national and international stage to think about what works in its existing world, but what can it do? What can it bring out internationally? And I think one of the things I've learned from the Crisis Jam actually is no matter what we do in our own country, in our own space, there is always opportunity to learn something different. And Global Leadership Exchange helps to bring those convening opportunities to bring leaders together to really help to do that. But I'm really heartened by the fact that we're now doing that more globally through all of our work. So this actually describes as a document a phased rollout around the shift in crisis to health services, creating that higher threshold for police intervention, how we think about the emergency department handover, which has always been a little bit tricky in New Zealand, but also in the UK. How we started to think about capped handover times, and I know you've done amazing work in the US actually around this, well in advance of the work that we're doing. How you started to think about a multi-agency 111 response with a 5-year plan that aligns to the work that's going on in New Zealand, and actually how we're reinforcing the fact that mental health distress is not a criminal matter. And that for me is one of the biggest learning bits actually. If you've ever been involved on the street of crisis intervention, how do we ensure that actually the person who is in crisis doesn't feel criminalised by their behaviour or what's going on because actually they're unwell? Doesn't mean that it's a criminal matter. So how do we ensure that? And this is a really good way of demonstrating that provided going forward. Linking that as well also helps us to think about suicide prevention. And then think about what the that bit do. Sorry, David, I'm just moving on to the next one. So you were right. Absolutely. Thank you. So what we've really identified in that report really is the real value of the 24/7 coverage through mobile crisis teams and crisis stabilisation units. But it's also how do we operate things like crisis cafes, creating the space. And I really love the way that the Crisis Jam anthem works around someone to talk to, someone to respond to, a safe place to go, and someone to follow up with is really, really important to ensure that actually the person in crisis actually gets the best service available to them. So actually thinking about then what is being learnt internationally through system-wide governance and standards, some great work going on in the UK, also in Europe, but also in Ireland around sharing the vision, but also learning that bit then around what's going on in the US, both at national and federal level. The one thing I've found really, really interesting is actually the move towards non-coercive trauma response care, because that's so important. People in crisis who get involved in in this intervention actually generally have probably a lot of trauma response in their history. So actually, how do we ensure that we reduce that position, which I think is really, really important. We've also then embedding that into the UNCRPD, so those rights and equity frameworks are really, really important. And then really focusing on actually youth specific, cultural specific, our diversity specific, thoughtful for me is very, very helpful. And then finally, actually, how do we create the environments to enable people to integrate and attend support before crisis is required? So, Crisis House led by peers. We're seeing some amazing work going on in Scotland at the moment, some work that we're going on in the UK and Ireland, quite a bit of work going on in Europe too that I see on a day-to-day basis, which is really supportive of those people who've lived and breathed and gone through the system, and we're bringing hope back to those individuals who are probably at the point of crisis feeling hopeless. How we're creating those really right purpose-built therapeutic intervention spaces. Because actually, if any of you have ever gone into the ED department, it's generally not the best place for someone who's in crisis. It's noisy, it's vibrant, there's loads going on, and actually you just need a space that's quiet and enable us to work and deal with that appropriately. But also the role of actually digital helplines and telepsychiatry actually is really, really integrated for me, which I think is so important about actually how we meet the demand and amplify our abilities to connect with people more broadly. Next slide, I think, is my final one as we go to do it. So for me, as a conclusion, the international review of suicide prevention mental health crisis has revealed a growing global commitment to evidence-based, culturally responsive and community-driven approach. So I think for me, that's really, really important. And what we need to think about is scalable and sustainable action. The Crisis Jam for me provides a great opportunity to demonstrate things in action. And I really, really welcome the ability to think about how we turn policy into practice. So for me, one of the things that our social care school in the UK talks about, systems leadership facilitates the adoption of a more integrated care through creating a shared vision with professionals, managers, and those with lived experience, keeping the interests of communities served at the heart of decisions. So for me, this is about making sure collectively we all work, whatever role we've got, in supporting that crisis reduction space and enabling people who are in crisis to get the best quality care in the right time by the right people in the right place. So thank you for letting us come and join you today. Really look forward to working with you again in the future, and hopefully people will be able to connect with Global Leadership Exchange going forward, and really look forward to the Crisis Now 4 that we'll talk about a little bit later, I'm sure. And David, over, and Fiona, Laura, sorry, back over to you.
Thank you, Sean. What a great summary. I just see what Dr. Morris put in the chat. I think you're spot on with those conclusions, particularly what is scalable and sustainable. So let me actually turn it over to Dr. Phil Moore, who is joining us, although he's based in the UK in London and is the chair of the Board of Trustees for Links International. He's currently, I think it's 4 a.m. where you are, Dr. Moore. Is that correct?
Yeah, my audio's on now. Yes, it is indeed just after 4 a.m., but that's fine. It's been a pleasure to just join you and say hi.
Yes, well, thank you for joining.
Apologies, my camera's not on, but I've got a problem with my camera on my laptop, so you can't see me.
That's quite all right. I think we're most interested in hearing what you took away from that lead story.
I think it is encouraging. I am delighted to hear a lot of the work that is going on. Some of it I know about, and some of it is a news to me. I think one of the things that we need to understand is that a mental health crisis may not necessarily indicate a mental illness. And I think we've got to be able to recognize that very often what people in crisis have is a crisis of their situation, the things that they're going through, their experiences in life. And very often all they need are friends and family around and people they can talk to come down from that crisis. And that that kind of mental distress and crisis is a part of human life. It's a part of all of our experiences from time to time. And therefore, I want to stop uh, having to label people because they have simply had a crisis in their life. What we need is good services that are able to support somebody in those situation and pick up the indications that somebody has gone beyond a simple crisis into a real mental illness crisis that needs specialist intervention. And I think that's the kind of nuancing of some of the messages that is beginning to get into the systems that we're putting into our various areas. Sean gave a good summary of some of the things that are going on in the UK. One level that he didn't mention is all of our mental health trusts, our mental health organizations in each area have got a mental health crisis line as well that people can access. So that's another level. And I think the important thing is that wherever people do access it, there is no wrong door to it, that they will then get put through to the right place for the right kind of support that they need. I think that's probably enough for me at the moment.
Well, if I could, Dr. Moore, just ask you one more thing, because I think that particularly what you said around a crisis is not necessarily a mental health diagnosis is so important. You hosted the first crisis now in London. Can you share just some thoughts around hosting that back in London and where we are today?
Well, I've forgotten. It's a good few years ago in London now. What I think has happened and what really impressed me at that meeting was an understanding of crisis from the individual's point of view. And I think what we did was we made a very important shift that many had already made, but I think it became much more widespread understanding what it meant to the individual who was going through the crisis and what individuals in that situation really needed from our services of all kinds in order to get them through that and out into the next stage of their life. That for me was one of the key things.
Awesome. Well, thank you so much, Dr. Moore. I'm now going to turn it to Sue Murray, who is based in Sydney, Australia, the practice leader of Zero Suicide Institute of Australia, where I think it is 2 a.m. your time. Is that correct, Sue?
You got it, Laura. It's 2 a.m., but happy to be here.
Thank you. Would you like to share some of your thoughts on that lead presentation or anything that Dr. Moore just said?
Yeah, so I think it was very interesting that Sean opened with the drivers of crisis haven't really changed. How we respond has changed. And my question would be, is it happening fast enough? Because the World Health Organization has just recently released its mental health atlas. And Sean pointed out the shift in to prevention and promotion and greater investment happening in Europe. But in fact, the WHO in their report has showed that only about 2/3 of their member countries that responded to their survey for the Atlas are actually looking at prevention and promotion investments. So the concept that Phil just mentioned in terms of looking at situational circumstances around how we respond to crises, that's really not yet on the agenda of enough places. And I think the other thing that we all know should be happening, but perhaps is not happening fast enough. And again, the WHO Atlas says very clearly this is not happening. And that is the shift away from institutionalized services to community based services. There's a very slow uptake. The WHO said that something like 73% of countries that responded to the Atlas reports, either 20% hadn't even started to think about how to shift to community-based services away from hospital-driven services. 53% are thinking about it. and are in early transition stages, only 10% have actually shifted into that, community driven and supported services. So it's a very, very slow shift. There's a lot of other interesting things that this mental health atlas report from the WHO has said, and again, one of those is looking at the investment that we're seeing, and Sean noted very significant investment happening in Europe, but globally, that's not really happening. What the report says is that the government financing of mental health services has not really increased over the last 5 to 10 years, and that the burden of financing support services for mental health conditions and mental health illnesses is really sitting in many instances with the family or private support for by the individual. So, there are some great pockets of things happening. And yes, most of those would be in the high income countries, like we're talking about Australia, England, the US. But when we look globally, there is so much more that needs to be done, and such a big cultural shift. We have got, I think Lifeline International has found that there's 28 countries that still criminalize suicide. So shifting legislation away from being a criminal act to one where we're responding with compassion and care and appropriate support. There's a lot of work we've still got to do.
Thank you so much for that, Sue, because it's just, and thank you for sharing that support, because even as we think about the work that we've done, you're right, there's so much more we need to do. And I wonder just if you had very quickly any thoughts on how we can ensure that the rest of the global community is coming. Just very briefly.
Look, yeah, I think it's how do we build these connections, as we have done through the Zero Suicide movement. We've got good global movement happening there. Let's bring the crisis discussions along as fast as we have with the zero movement.
Awesome.
I think it's that connecting countries together.
Yes, thank you so much, Sue, Dr. Moore, Sean. Hopefully the Crisis Jam is one of those places, and we look forward to seeing you all in other spaces. And thank you for joining us, even though it is so early where you are. So with that, I will turn it over for our briefing room segment. We will first hear from SAMHSA, and I believe we have Justin from SAMHSA who will be joining us. Oh, thank you. All right, Justin, over to you.
Yes, I'm here. Thank you. As they say, long-time listener, first-time caller here on the Crisis Jam. So happy to be here. My name's Justin. I do serve on the suicide prevention branch at SAMHSA. And among other duties, I help oversee the Community Crisis Response Partnerships, or CCRP grant program, which, interesting fact, is the only federal discretionary grant program focused exclusively on mobile crisis team services. So again, very happy to be here. First off, from SAMHSA, we want to express gratitude for everyone who participated in 988 Day. We were very pleased to see all the posts and interactions. Such a wonderful opportunity to get the word out about 988 and promote those help-seeking behaviors. And of course, today, happy World Suicide Prevention Day. And of course, for the remainder of September, it is still Suicide Prevention Month and National Recovery Month. So I encourage everyone, check out the toolkits that are available on the SAMHSA website for both of those observances. A couple other updates, two notable documents. One, the 2025 National Guidelines for a Behavioral Health Coordinated System of Crisis Care, as well as the model definitions for behavioral health emergency, crisis, and crisis-related services. Those are temporarily offline for further editing, but we hope to see them back online in about 1 week for you to be able to access. And we are still hard at work putting the finishing touches on the third publication in that series, the Mobile Crisis Team Resource Manual, which we believe will be a great resource for the field once that is released publicly. And I guess lastly, as we approach the beginning of a new federal fiscal year, we certainly look forward to continuing our role and work in supporting the congressionally authorized life-saving grant programs in suicide prevention and crisis services. So that's it from us today.
Thank you so much, Justin. Appreciate all that SAMHSA does to help support suicide prevention, 988, and crisis services in the US. So thank you for joining us. So now I'll turn it over to Dr. Pollard from NASHBID for their updates.
I like the new graphics. I'm missing my lovely glamour shot that used to be up there, but we'll go with it. I happen to, I think, complement nicely Sean Russell's presentation from earlier with a couple of themes that I want to discuss from NASHBID that we're very happy to have received notification that we'll have another year of the State Technical Assistance Project. So that program has been running for the past 3 years and will go into another year of providing technical assistance to state mental health authorities and the programs they support, as well as the substance use authorities. So feel free to reach out to us if you are a state leader or you want to discuss what's available through the state TA resource. I'll put some links in the chat when I'm done speaking. And we also are developing a number of resources under that, from webinars, peer-to-peers, learning communities, and guidance manuals, things like that. One of the themes that is part of the state TA contract or state TA project is early serious mental illness. So that early detection, early intervention that was mentioned earlier. We're wrapping up our early serious mental illness state leader peer-to-peer learning community that we've been hosting in collaboration with WestApp. So I'm really pleased to note that, because there is continued strong support for growing our early intervention programs, even beyond the amazing success that we've seen over the past decade or so, going from a handful of first episode psychosis programs around the country to now literally hundreds, and many clinical high risk for psychosis programs as well. So that peer-to-peer, we had 17 states join us with 32 participants across those states. We covered topics ranging from financing. States talked about how they're developing team-based care rates to make sure all of the elements are included. Workforce is our last topic, which we'll talk about tomorrow. And that is, we're hearing from Utah and Ohio about their innovative support for workforce development, rural, and a number of other topics. So I bring that up to say we continue to see strong support for the expansion of early intervention for serious mental illness at the state levels, and I'm very, very happy to see that. Digital mental health is another topic I want to keep circling back to on the Crisis Jam during our NASHBID segment. And so I want to give a shout out to another of our global partners, the Digital Mental Health Global Congress. So EMIC is the organization that we collaborate with. They'll be hosting the Digital Mental Health Global Congress the 19th through the 21st of November in Toronto. I'll put a link in the chat in a moment in case you want to check it out and hopefully join me there in Toronto. NASHBID will be participating, and over 40 countries will be represented there. We had the opportunity to go last year, and I certainly learned a lot and developed a lot of good relationships. We'll be participating at that event in a think tank on systems navigation, which I think is highly relevant to the work we do in crisis care. And then also Behavioral Health Technology Conference, the 11th through the 13th of November in San Diego. So I'll link both of those. And both of those are open to providers, mental health leaders, policymakers, So not if you're thinking of those as people who are in the technology industry, it's not the case. It's definitely people who would implement these in real world practice or at a policy level. So thanks for the time, and I will turn the floor back over to Laura.
Thank you so much, Dr. Pollard. Appreciate that update from Nashville and looking forward to hearing how some of those states are looking at various components, including workforce. So with that, we will move ahead to our next segment, and I'd like to invite Stephanie Pasternak from NAMI.
Thanks, Laura. So actually for today's show, we are not going to do our normal state heat map update. Instead, I was going to do an update on 988 Day, which was, of course, Monday, and share a little bit about how NAMI approached spreading the word on 988 on the second annual 988 Day. To set the scene, I first want to say that the 988 Day vision, theme, and toolkits that SAMHSA provided and Vibrant provided to all of the 988 Day stakeholders were so incredibly helpful. I'm going to share how we kind of took that direction and ran with it, but really want to say that my hat is off to all the individuals and organizations that participated. I saw so many creative and impactful awareness activities going on across the country. So for NAMI, we decided to focus a lot on social media engagement for 988 Day, recognizing, social media is where a lot of people pick up their news, pick up information. So we decided to provide sample social media and graphics to all the 600 plus state and local NAMI organizations to help spread the word, and of course post it on our national platform too. And you are seeing some examples of those graphics here. We embraced this year's theme of compassionate help anywhere, anytime. Just shared a lot of messages conveying how accessible and easy it is to reach out to 988. We actually did a recent awareness poll that told us a lot of people have at least heard of 988, but far fewer people said they were actually familiar with the help that 988 provides. So we also wanted to use this day to provide some of that education and fill in that gap. We took one of the activity suggestions and did a facts about 988 video. That's what's on the far left, with our whole advocacy team to so folks could know when to call, what to expect. And you can find a lot of this all on our Instagram page. And just to touch on a few other things we did, we also wanted to send the message that 988 works, and one of the single best ways to do that is to share personal real life experiences. And here are a couple stories that we shared, like Anne in California, who told us that I called the 988 line twice. Both times, I believe it saved my life. And we also had a family member, Kenneth in Minnesota, who shared that 988 helped my family deal with a crisis with a loved one. We were able to get the required guidance and take the appropriate measures and action. We are eternally grateful. So some really impactful stories there. We also, other ways we were leveraging media, we did a radio tour with myself and also NAMI's Chief Advocacy Officer, Hannah Wesolowski, who I know has made a few appearances on the Jam here before and also on 988 Day. We reached over 4.6 million listeners with that radio tour. And one fun, tidbit to share and just amazing thing that came out of those radio shows was really realizing how much focusing on 988 and suicide prevention and mental health meant to the radio show hosts. We actually had one host share on the show that he was a suicide attempt survivor and how much it meant to him to be able to help spread the word. We also had encouraged folks to do local op-eds. That's always a great way to get the word out. And so we have a local example here from NAMI Coeur d'Alene in northern Idaho on the right there. And I will say that then the final strategy that we used was to use 98 Days as, of course, an advocacy opportunity. We, furthest on the left there, sent an alert to tens of thousands of our grassroots advocates, and they could also share a story with us, but we also asked them to write to their members of Congress to keep robust federal funding for 988 as a priority for Congress. At the same time, we also encouraged members of Congress to post. And I'm just sharing a couple examples here. We have Representative Vern Buchanan in Florida reminding his constituents that it's okay to not be okay, and they can reach out to 988 for support. We also have Congressman Gabe Amo talking about how many Rhode Islanders have been helped by 988. So yes, I think I'm coming up on my time, but I think 98 Day was a great success. Thanks again on everyone who took the time to talk to your friends, your family members, your community about 988. It was just amazing to see so many wonderful messages on Monday of hope and healing, and looking forward to the next 98 Day already.
Thank you so much, Steph and Nami and Samsa and Vibrant and everyone who participated in 98 Day, making sure that we are letting folks know, building awareness of the service. And because the theme of this jam this week is global leadership and that collaboration to help share best practices or what has worked, I'm hoping maybe Dr. Brian Hepburn could come off mute and maybe share some thoughts on both the state and the federal, the work that's gone on through Crisis Now 1, all through Crisis Now 3. Brian, are you with us to share some thoughts? Okay, looks like we may have lost Brian, but that
No,
was
I'm here. I'm here,
okay.
Laura. I'm sorry. I'm old. It takes me a while to hit the right button. So, yeah, thank you. We're really excited that, well, for today's show, having people like Sean on and providing the international perspective, it was very good. And I thought the whole presentation today, and of course, with your leadership, Laura, it's always excellent. But yeah, thanks for the opportunity, because we're excited at NASHBID that we'll be able to participate next year with our annual meeting being next to the Crisis Summit, and being able to participate on an international level through the GLE and working with the 988 JAM to basically continue to bring attention to crisis services and to the good work that's been done by SAMHSA, by Vibrant, by states all across the country. And bringing in that international perspective, as which was done today, really helps us to move towards best practices and really move towards a global threshold for what is a good service and what's the best way to achieve crisis services. So thank you for the opportunity, Laura, and it's great to see you. You just look younger and younger, so thank you.
Oh, thank you, Dr. Hepburn. Flattery will get you everywhere. So I teased some big news. So I'm going to turn it over to Kristen Ellis from RI to close us out.
Thank you, Laura. What a great episode today. Huge thanks to our panelists and those of us that joined us in the middle of the night, and for all of you in the chat for engaging week after week. For many seasons, the Crisis Jam has been proudly sponsored by SAMHSA through NASHBIT, and as their support has been essential to this work, but this chapter is coming to a close at the end of season 5 today. We are thrilled to share that our first 2 new sponsors will be announced very, very soon. A big step forward for this community's growth and future, but we are still looking for a few new partners to keep the jam rocking and growing. So if you're interested, please reach out to us. Next week, we will launch season 6 with the Battle of the Bills. Joining us is going to be Senator Tina Orwell and Representative Steve Elison, 2 national leaders in behavioral health legislation. They're going to take us behind the scenes to explore how bills are built and why they matter for the future of crisis. And plus, Ursula Whiteside is going to stop by briefly to share concerns about AI being used as therapy, which will be a timely and thought-provoking addition. And in 2 weeks, please don't miss our fireside chat with Dr. Thomas Joyner on the vital roles of connection and belonging in suicide prevention and recovery. Thanks for watching. We're going to tune in, log on, join the movement. See you next week.